I want to talk to you today about something a fair number of older adults notice and find a little alarming, and that's usually harmless but worth understanding: the feeling of your heart skipping a beat, fluttering or thumping when you bend over, change position, or strain. Because it can be startling to feel your heart do something odd, just as you bend down to tie a shoe or pick something up. And it's natural to wonder if something is wrong. Yet these positional skipped or extra beats are usually harmless, though sometimes worth checking, so understanding them helps you respond wisely. So, today I want to explain what's happening when your heart seems to skip a beat on bending or position changes, why it's usually harmless, when palpitations are worth checking, and what to do, in partnership with your doctor. And I'll keep this calm and balanced, because while feeling your heart skip on bending is usually harmless, palpitations can sometimes warrant checking, and understanding the difference lets you respond wisely, neither over-worrying nor missing the signs that matter, in partnership with your doctor. This is about an unsettling but usually harmless experience, held in proportion. Let me start with what's happening when your heart seems to skip a beat, because understanding it is reassuring. The sensation of your heart skipping a beat, fluttering, or giving an extra strong thump is usually due to what doctors call ectopic beats, or extra beats, which are early or extra heartbeats that most people experience and that are usually completely harmless. What you feel as a skip is often an early extra beat, followed by a slightly longer pause and then a stronger beat, which you perceive as a skip and a thump. These extra beats are extremely common, and the vast majority are benign, occurring in healthy hearts. So, when you feel your heart skip a beat, it's usually these harmless extra or early beats, which nearly everyone has, not a sign of a serious problem. So, understanding that a skipped beat is usually a harmless extra beat, which is very common, is reassuring. So, a skipped beat is usually a harmless, very common extra beat. So, the skip sensation is usually benign extra beats. Let me explain why bending over or position changes can bring this on, because it's the specific point. Several things about bending over, changing position, or straining can make you notice, or perhaps bring on these extra beats. First, perception. When you bend over or change position, your body position and the pressure in your chest and abdomen change, which can make you more aware of your heartbeat or of an extra beat you might not otherwise notice. Second, bending and straining involve some bearing down, like a mild version of the straining I've discussed, which transiently affects the pressures around the heart and the heart's filling, and can sometimes trigger or make you notice an extra beat. Third, position changes affect blood flow and the heart momentarily, which can be associated with noticing beats. So, feeling your heart skip on bending is usually a combination of becoming more aware of your heartbeat in that position, and the mild effects of bending and straining on the heart, bringing on or highlighting of a harmless extra beat. So, bending or position changes can bring on or highlight harmless extra beats through changed awareness and the mild effects of bending and straining on the heart. So, bending highlights or triggers benign extra beats. So, position changes make benign extra beats noticeable. Let me reassure you about how common and benign this usually is, because it matters. Let me reassure you, occasionally feeling your heart skip, flutter, or thump, including on bending or position changes, is extremely common and usually completely harmless, experienced by many healthy people, including older adults. The occasional extra beat, even if startling, is a normal quirk of the heart's electrical system, and usually means nothing is wrong. Common things can make extra beats more frequent or noticeable, including caffeine, alcohol, stress and anxiety, tiredness, and others, all usually benign. So, please don't be alarmed by the occasional skipped beat on bending. The large majority of such experiences are harmless. The nuance I'll discuss is about certain patterns or accompanying features warranting checking, not the occasional benign skip being a worry. So, occasionally feeling your heart skip on bending is extremely common and usually harmless, a normal quirk often made more noticeable by caffeine, alcohol, stress, or tiredness. Not usually a sign of anything wrong. So, the occasional skip on bending is usually benign. So, don't be alarmed by occasional skipped beats. Let me be clear about when palpitations are worth checking, because some warrant attention. While usually harmless, palpitations, including skipped or extra beats, are worth checking in certain situations, as I've discussed. See your doctor if your palpitations are frequent, persistent, or worsening. are prolonged or come in sustained episodes of a fast or irregular heartbeat, rather than just occasional skips. Come with chest pain, breathlessness, dizziness, or fainting, which is more concerning. Feel like a sustained irregular heartbeat, which could relate to a rhythm problem like the atrial fibrillation I've discussed, or occur in someone with known heart disease or significant risk factors. And, crucially, seek prompt or emergency attention for palpitations with chest pain or pressure, severe breathlessness, or fainting. By contrast, occasional skipped or extra beats on bending or otherwise, without these features, in an otherwise well person, are usually benign, though worth mentioning to your doctor if frequent or concerning. So, see your doctor for palpitations that are frequent, persistent, prolonged, sustained, and irregular, or come with chest pain, breathlessness, dizziness, or fainting, or in those with heart disease, while occasional skips on bending without. These are usually benign, and seek emergency care for palpitations with chest pain, severe breathlessness, or fainting. So, know when palpitations warrant checking or urgent care. So, heed the concerning features of palpitations. Let me explain why checking the concerning kind matters, because it can catch treatable things. Getting concerning palpitations checked matters because, while most are benign extra beats, some reflect a heart rhythm problem worth identifying and treating, like atrial fibrillation, which, as I've discussed, is important to catch because it raises stroke risk and is very treatable. So, catching it through heeding concerning palpitations genuinely protects you. Other rhythm problems or underlying causes like the thyroid problems or anemia I've discussed can also be found and treated, and very frequent extra beats occasionally can warrant attention. So, heeding palpitations with concerning features and getting them checked can catch treatable rhythm problems and underlying causes, whereas dismissing genuinely concerning palpitations could miss something important, even as the occasional benign skip needs no alarm. So, checking concerning palpitations can catch treatable rhythm problems like atrial fibrillation and underlying causes, genuinely protecting you, while the occasional benign skip needs no alarm. So, checking the concerning kind can catch treatable problems. So, heeding concerning palpitations genuinely matters. Let me give you what to do, because the response is clear. For benign occasional skips on bending, reassurance and sensible measures help. Understand that occasionally feeling your heart skip on bending is usually harmless, extra beats made more noticeable. Reduce triggers like caffeine, alcohol, stress, and tiredness, which can increase extra beats. And don't be alarmed by the occasional skip, but see your doctor if your palpitations have the concerning features: frequent, persistent, prolonged, sustained, and irregular, or with chest pain, breathlessness, dizziness, or fainting, or in those with heart disease, so the cause can be assessed, often with heart rhythm monitoring and other tests, and any rhythm problem or underlying cause found and treated, and seek emergency care for palpitations with chest pain, severe breathlessness, or fainting. So, manage benign occasional skips with reassurance and reducing triggers, but see your doctor for concerning palpitations, and seek emergency care for the serious ones. So, reassure and manage benign skips, and check the concerning kind. So, the response depends on the features. Let me paint you a quick picture of how this helps. 2 ways. First, picture a woman in her 70s who's been startled and worried by feeling her heart skip and thump whenever she bends over to pick something up. She learns that this is usually harmless extra beats, very common and made more noticeable by bending, and that her caffeine and stress may be increasing them. So, reassured, she cuts her coffee, manages her stress, and stops worrying about the occasional skip, which troubles her far less. That's the common, reassuring case. Now, picture a man in his 70s whose palpitations are frequent and feel like a sustained, irregular heartbeat, sometimes with breathlessness, not just occasional skips. Rather than dismiss them, he sees his doctor, who, with heart rhythm monitoring, finds atrial fibrillation, which is then treated, including protecting him from its stroke risk. The contrast shows the value of understanding which palpitations are benign and which warrant checking. So, understanding palpitations reassured one and caught the other's atrial fibrillation. Let me speak briefly to those of you caring for an older parent or partner. Understand that feeling the heart skip on bending or position changes is usually harmless extra beats, very common and often made more noticeable by bending, caffeine, alcohol, stress, or tiredness, but that some palpitations warrant checking. You can help by reassuring them about occasional benign skips and suggesting reducing triggers like caffeine and stress. But encourage seeing the doctor if palpitations are frequent, persistent, prolonged, sustained, and irregular, or come with chest pain, breathlessness, dizziness, or fainting, or occur with heart disease, since these can reflect a treatable rhythm problem like atrial fibrillation. And know that palpitations with chest pain, severe breathlessness, or fainting need emergency care. Helping a loved one tell benign skips from the concerning kind and check the latter can reassure them while catching anything important. So, let me draw this all together. Feeling your heart skip a beat, flutter, or thump when you bend over or change position is usually harmless. It's typically due to extra or early beats, which most people have and are usually completely benign, made more noticeable by the changed awareness and the mild effects of bending and straining on the heart, and often increased by caffeine, alcohol, stress, or tiredness. So, the occasional skip on bending is usually nothing to worry about. But palpitations are worth checking if frequent, persistent, prolonged, sustained, and irregular, or accompanied by chest pain, breathlessness, dizziness, or fainting, or in those with heart disease, since some reflect treatable rhythm problems like atrial fibrillation, while palpitations with chest pain, severe breathlessness, or fainting need emergency care. So manage benign occasional skips with reassurance and reducing triggers, but see your doctor for the concerning kind and seek emergency care for the serious ones. So here's what I'll leave you with, straight and clear. First, understand that feeling your heart skip a beat on bending is usually due to harmless extra or early beats, which most people have, made more noticeable by the changed awareness and mild effects of bending and straining. Second, know that this is extremely common and usually completely harmless, often increased by caffeine, alcohol, stress, or tiredness. So, the occasional skip on bending usually means nothing is wrong. Third, reduce triggers like caffeine, alcohol, stress, and tiredness if you get frequent benign skips, and don't be alarmed by the occasional one. Fourth, see your doctor if your palpitations are frequent, persistent, prolonged, or feel like a sustained irregular heartbeat, or come with chest pain, breathlessness, dizziness, or fainting, or occur in someone with heart disease, since some reflect treatable rhythm problems like atrial fibrillation worth catching. And fifth, seek emergency care for palpitations with chest pain, severe breathlessness, or fainting. Feeling your heart skip on bending is usually a harmless quirk, but some palpitations warrant checking, so understanding the difference lets you respond wisely, reassured about the benign, and checking the concerning, which is well worth doing. So, take care of yourself, understand benign skips on bending, reduce triggers, and see your doctor for the concerning kind. And because some palpitations can reflect a treatable rhythm problem needing diagnosis, please treat frequent, persistent, prolonged, or sustained irregular palpitations, or palpitations with chest pain, breathlessness, dizziness, or fainting, as your reason to see your own physician and seek emergency care for palpitations with chest pain, severe breathlessness, or fainting.